Assalamu alaikum. Hello everybody. Today our video about diagnosing musculoskeletal sonopathologies. As you know, metaphoric signs promote learning and retention of the characteristic appearances and allow the examiners to easily recall the specific condition. In this regard, this video represents a collection of findings pertaining to commonplace pathological conditions. This video is the second part of a series after the characteristic metaphoric descriptions of normal musculoskeletal structures. We will begin with number 1, crocodile mouth. Most of the supraspinatus tendon tears ensure in the distal insertion critical zone, whereas short axis view tire appearance is quite demonstrative for a detailed description of the rupture. Long axis view of the tendon distal to the acromion would also be guiding in the initial step. In other words, the convex bird's beak might no more be present or even worse, be placed by an irregular and scary crocodile mouth. Number 2, flat tire. Supraspinatus tendon tears often appear as anechoic or hypoechoic on ultrasound. During short axis imaging, a healthy tendon is convex, looks like a tire, and can't be compressed under sonopalpation. In case of a full thickness tear, the appearance will turn into a flat tire whereby deltoid muscle and the subdeltoid bursa would be filling the space. Needless to say, if the image of a flat tire is not straightforward, comparison with the probe would be noteworthy to make it apparent. Number 3, bridge. Soft tissue calcifications can be caused by a broad range of pathologies, that is, tendinopathy, myositis ossificans, rheumatic conditions, and malignancy. Notably, whereas dense, hard, and large calcific deposits produce a typical posterior acoustic shadowing, less dense, soft, or small calcifications may not always be accompanied by shadowing. Likewise, the phase of calcification may also impact whether the lesion will produce this artifact. Although calcifications vary in density, location, size, and shape, the sonographic appearance of superficial ones can resemble a single cistern bridge, and the river represents the acoustic shadowing artifact. Number 4, halo, or eye of the tiger. Synovial, parietal, and visceral sheaths are structures that facilitate the sliding of tendons. In the presence of inflammation within tendon sheaths, like long head of biceps tendon or wrist extensor tendons or others, the fluid appears as a dark halo on ultrasound examination. Of note, because of the synovial sheath can sometimes be associated with the joint space, for example, shoulder, it is necessary to differentiate primary tendon problems from other articular pathologies. Furthermore, as comparison is an important advantage of ultrasound examination, bilateral halos may be reminiscent of tiger eyes. Number 5, snowstorm. In gouty arthritis, the main sonographic findings suggestive for monosodium urate crystal deposition are tophi, the double contour sign, and the snowstorm. The characteristic image of the latter consists of multiple hyperechoic spots floating within the synovial fluid and surrounded by the synovium. These microtophi correspond to aggregates of monosodium urate monohydrate crystals. Number 6. Bottleneck. When a peripheral nerve becomes entrapped, the deformation results in pressure gradients, which redistributes the tissue to areas of lower pressure. In addition, compression inhibits normal intraneuronal exoplasmic transport and various substances, for example, transmitter substance vesicles and cytoskeletal elements accumulate. Eventually, mechanical and/or ischemic factors can cause nerve swelling, usually just proximal to the entrapment site. In certain cases, for example after carpal tunnel surgery, nerve edema can also be present distal to the entrapment site and appears as an hourglass. In daily clinical practice, peripheral nerves are usually easily tracked in short axis, and if an abnormality, for example increased nerve caliber or hypoechogenicity, is detected, the probe is rotated 90 degrees and the typical appearance of bottleneck can be observed in long axis view. Needless to say, the neck represents the point of nerve compression. Number 7. Comet tail. In the universe, a family of asteroids is usually identified for their brilliant tails. Likewise, in the musculoskeletal system, metallic foreign objects like screw, implant, give this reverberation artifact long hyperechoic bands, owing to their feature of randomly reflecting the ultrasound beams. Number 8. Rat tail. Target and bag of worms. High-resolution ultrasound is considered as the mainstay for detecting and/or diagnosing peripheral nerve sheath tumors. The most prevalent types of solitary benign tumors in adults are schwannoma and neurofibroma. The former is derived from neoplastic Schwann cells, and the latter originates from Schwann cells as well as from other tissues of the nerve sheath. Although the definitive diagnosis is histopathological, both display some characteristic findings on ultrasound examination. For instance, a round shape strongly suggests a schwannoma. A fusiform shape is relatively typical for a neurofibroma, and an oval shape is common for both. In contrast to neurofibromas, schwannomas appear in an eccentric position with regard to the peripheral nerve trunk. Accordingly, the characteristic rat tail, a thin hyperechoic line entering and exiting the nerve appearance, is present in approximately half of the schwannomas patient. Another ultrasound feature, which is more common in neurofibromas, is the target sign. It is characterized by a hyperechoic fibrous center with a hypoechoic periphery that contains predominantly myxomatous material. A subtype of neurofibromas that frequently develops in individuals with neurofibromatosis type 1 is plexiform neurofibroma. In contrast to localized neurofibromas that arise from a single peripheral nerve, plexiform neurofibromas originates from multiple nerves and involve perineural components as well as other soft tissue components. As such, a bulging mass that comprises tortuous bundles of enlarged, disorganized nerves and connective tissues appear as bag of worms on macroscopic inspection and ultrasound alike. The ultrasound appearance is that of multiple hypoechoic nodules, pore margins, and several feeding vessels within hyperechoic connective tissue. Notably, these tumors are at significant risk for eventual malignant transformation. Number 9. Black hole. Sonotracking of a skeletal muscle in short axis view can show sudden disappearance of the normal star sky appearance, alteration of hypoechoic fascicles and hyperechoic perimeseum, being replaced by a large black hole, similar to the absence of light in black holes of the universe. No acoustic interfaces can be identified inside an acute or subacute muscle injury due to hemorrhage instead of connective tissue and muscle fibers. Under Bromet sonopalpation, compressibility and or displacement of the black hole can confirm the lesion as well as the possibility of aspiration. Number 10. Misty muscle. Sonotracking of a denervated skeletal muscle in short axis view can clearly show fibroadipose involution. In other words, unlike the star sky, a coarse pattern with low visibility of the hypoechoic background, which is muscle fibers, and increase the hyperechoic connective tissues, which is perimeseum, can be observed. That is a misty muscle. Of note, the blurred muscle tissue would also reduce the sonographic visibility of deeper anatomical layers, owing to the presence of excessive and or pathological acoustic interfaces that attenuates the ultrasonic beam. Number 11. Clouds. Myositis ossificans is a rare complication that mostly occurs after traumatic large muscle injury. Ultrasound can significantly be contributory in the early diagnosis, even at stages when radiographs are negative. Multiple and or irregular hypoechoic and hyperechoic layers accompanied by posterior acoustic shadowing is the main scenario mimicking clouds or cloudy weather. Number 11. Pistol grip deformity. Femoral-acetabular impingement syndrome is a clinical entity that refers to the disrupted relationship between the two bones due to morphological abnormalities from either side. The two basic types, for example, cam and pincer, can be evaluated by X-ray, magnetic resonance imaging, and computed tomography, but ultrasound examination might be of additional values if performed dynamically. During long-axis imaging for a cam lesion, the shape of the proximal femur resembles a pistol grip. Number 13. Boomerang and speech bubble. The bursa between semimembranosus and the medial head of the gastrocnemius tendons is the place of origin for popliteal or Baker's cyst. While its normal or mildly swollen shape resembles a boomerang, the appearance looks more like a speech bubble in case of further fluid collection. The latter occurs mainly because of the dilatation of the superficial arm of the bursa. Of note, although the accumulation often contains homogeneous and or anechoic fluid, different sonographic findings ranging from fibrous septa to hypertrophic and or floating synovial villi floating inside the cavity might not be uncommon. Accordingly, in addition to the shape of a Baker's cyst, the appearance of its content would also be important before an onward intervention. Number 14. Volcano or eruption. In several joints of the musculoskeletal system, the presence of an intra-articular triangular fibrocartilage can be related to a peculiar pathological finding that looks like a volcano or eruption. For instance, longitudinal scan over the acromioclavicular joint or the medial aspect of the knee joint shows in some patients the bulging of the aforementioned intra-articular fibrocartilage, also bulging the overlying capsular tissue. In this sense, the joint line can be considered as the mouth of the volcano and the ejected and or extruded meniscocapsular tissue as the boiling magma. Needless to say, clear recognition of these pathologies might easily navigate the clinician for prompt interventional planning to cool down the natural phenomena. Number 15. Shark head and lips. Tennis leg refers to strain lesions of the myotendinous junction of the medial head of the gastrocnemius muscle. Intramuscular tear, deteriorated pennation pattern, fluid in the facial planes, and the hematoma can be visualized under ultrasound examination. Especially the presence of fluid between the medial head of the gastrocnemius and the soleus muscle or aponeurosis might appear as a shark head with open mouth during long axis view. On the other hand, in short axis imaging, the same vista might sometimes look like lips. Number 16. Atomic mushroom. In patients with clinical suspicion of Morton's neuroma, short axis view, dynamic assessment can be performed over the metatarsal heads using the Mulder maneuver. A hypoechoic mass protruding outward or a typical artifact when it is located inward can be quite pathognomonic. The outward jumping neuroma can appear as the activation of atomic bomb that is exploding and generating an atomic mushroom.